Welcome back, everybody. We've had doctors from Ochsner's MD Anderson Cancer Center joining us all month long to focus on different kinds of cancer care. And today, we are focusing on neuro-oncology, or the treatments of cancers of the brain, the spine, and central nervous system. I am so excited to welcome Dr. Marcus Ware, a neurosurgical oncologist, and Dr. Caroline Golden, a neuro-oncologist. They're going to tell us more about how they're treating these different types of cancers. Welcome to the show, beautiful people.
Thank you.
Yes, MDs are in the house like they've been all month long. Super excited to have you all here. And Dr. Caroline, I want to start with you. When it comes to like central nervous system cancers, what are some of the most common?
Yeah, so some of the most common nervous system cancers are primary brain tumors and primary spine tumors. And those can include things like high-grade gliomas. Glioblastoma is one of the most common, low-grade gliomas, and meningiomas.
Wow.
And the most common brain tumor is actually a metastatic brain tumor, so cancer that starts somewhere else in the body and then spreads to the brain.
How does that happen?
There are a lot of different ways and a lot that we don't know about it. Sometimes it can spread through the blood, sometimes it can spread through the lymphatic system, sometimes it can spread up to bone and then disseminate into the nervous system directly that way.
Wow, so when we're talking about brain tumors here, what are some of the symptoms of a brain tumor?
The symptoms really depend on where the brain tumor is and how quickly it's grown. For certain brain tumors, it can cause an increase in intracranial pressure, which looks like headaches in the morning, nausea and vomiting, headaches that are worse with pressure, bending over, straining. For other brain tumors that are in different areas of the brain, it can cause things like personality changes, sleepiness, weakness, sensory changes, or seizures.
And like other types of cancers, are there stages as well of brain tumors? Stage 1, stage 2, stage 3? Or is it just once you have it, you have it?
Sure, we go on a grading system. And the reason for that is when we talk about staging in cancers, we're usually talking about how far throughout the body the cancer is spread. With central nervous system cancers, they tend to stay within the central nervous system and they don't spread throughout the body. And so instead of calling it a stage, we call it a grade. We grade them on a scale of 1 to 4, where 1 is the least aggressive and 4 is the most aggressive.
And what's interesting is not only are brain tumors very common, but spinal cord tumors also are common. Dr. Ware, talk to me about some of the symptoms of a spinal cord tumor.
Sure, just like brain tumors, the symptoms depend on where they can occur. So if you think about the spinal axis, you have your cervical spine, your thoracic spine, and your lumbar spine. And the way you should think about the spinal cord is that it's sort of like a cable that carries signals to your muscles and your arms and your legs. So if you have basically a tumor that affects your cervical cord, it can actually compress that and cause weakness in your arms and your legs. If it's in the thoracic or lumbar, it can cause problems and weakness in your legs and numbness in your legs also. So it depends on where it is and how large it is.
And what's interesting is that at MD Anderson, you know, the new partnership between them and Ochsner, congratulations on that, by the way. First of its kind for the state of Louisiana. You all are doing different treatments there. One that you use is the gamma knife. I've never heard of this. Talk to us about what that procedure is.
Yeah, so the gamma knife is a unit where we can actually give what's called stereotactic radiosurgery. And so what that is pinpoint radiation. We can actually focus that radiation on tumors or other structures that we want to treat. The reason why it's called a gamma knife, the word knife is there, it's there because the procedure is ablative, which means that you can actually give enough radiation to destroy a structure. So let's say you have a tumor that's deep in your brain, and it is so deep that going there and actually doing the operation to remove it would cause more harm than good. We can focus the radiation on that tumor, treat that tumor so that the tumor dies, and then make sure that the structures around it will survive because we can limit the radiation to those structures.
Come on, it is 2023, everybody. New procedures are out there. And I want to ask you, Dr. Caroline, like when it comes to any way to prevent brain tumors, spinal cord tumors, is there one tip you can offer us so that we don't develop them?
Unfortunately, there are not a lot of known risk factors for brain and spinal cord tumors. The two risk factors that we know of are what's called ionizing radiation. And so that's not things like cell phones, but it would be things like working near a radiation plant, things like that. The second known risk factor for developing these cancers is a genetic predisposition. So there are very specific cancer syndromes that are very rare that can run in families.
This is a fascinating conversation. I want to thank you both and all the doctors from MD Anderson and Ochsner who have joined us this month. Congratulations on the new partnership. This is big, everybody, for the state. And look, if you want more information about everything that they're doing over at Ochsner MD Anderson Cancer Center, log on to ochsner.org/incancer.